Hi, my name's Wendy Caldwell. I am a registered dental hygienist. I've been in dentistry for many, many years. So I'm going to keep this as informative and short as possible. We're going to call it Denture and Oral Care 101. The first point is, why are we even concerned with oral care and hygiene? The proven fact is that periodontal disease is directly related to Alzheimer's and also diabetes. So we should be concerned with this because the pathogens found in the mouth have also been found in the brains of Alzheimer's patients. Diabetes and periodontal disease go hand in hand, so we should be concerned with that as well. They directly affect each other. The blood sugar affects the tissues, and the tissues affect the blood sugars and the diabetes. So they go hand in hand, and we should be concerned about this. If these oral pathogens in the mouth are abundant, they are not being removed or controlled, and that's where we come in. They can affect the lungs and cause respiratory issues, which lead to pneumonia. Excessive bacteria also enters the bloodstream, which can lead to heart disease. It's a proven fact on that. Diabetes, inflammation in general. It's not good for our bodies, so we need to keep it in control. We are healthcare workers. We're working together. We're trying to maintain or better these residents' health. So that's why we need to do this. Why do we need to leave partials and dentures out on a daily basis for a period of time? Well, simple. We need to make sure that these tissues are getting some air. Just like our feet, we don't want to wear socks 24/7, so we need to allow the tissue to breathe. Some of these people do not want to go without their dentures or partials, especially at night. So we can give them an option to go ahead and leave them out during the day while they're taking a shower or for just while they're sitting watching TV, something to allow this tissue to be able to have some air to it. Removables can also lead to fungal infections, which, yes, they can be treated, but you don't want that in there. You don't have to worry about that, so it allows that to not happen as much. They also harbor just plain old bacteria, and it's a very warm, moist environment, so the bacteria thrive. The tissues become red and inflamed. If that partial is left in there and you take it out, and you'll see that red line right there where the partial is, and so we need to leave that out for a while. It also gives you the ability as an aide or helper to inspect the mouth really quick. It doesn't take but a second to look in there and make sure there's no sores or irritations. Then we need to address that. And we need to be able to clean them. Just brush them off. It's really easy to brush them off on a daily basis. It's really hard to get it off after it's been there for months. Okay. Also, if these sores continue, it can lead to other problems. And in fact, it can lead to cancer, because if it's a constant irritation, it can lead to that. So we want to try to allow these sores to heal for a couple weeks. If they're not getting better, we need to be concerned. The dentures can stay out unless they're eating, and that will allow it to heal as well. Also, salt water is a great tool to get them to do that, to help in healing as well. Up to 3 times a day for, a few weeks. When you're leaving the dentures out, make sure you're putting them into some kind of liquid. It doesn't have to have anything in it, but preferably to keep the bacteria down as well. So put them either in Efferdent, or you can put them in a mixture of mouthwash and water. And if you leave them out for extended period of time and you leave the denture in the bath, make sure to change that water or mouthwash or whatever, because it gets nasty. Okay, and it can get mold on it. I've seen that as well. It stinks. Plaque is basically a mixture of bacteria and their waste products. It looks like white fuzzy material in there. Just keep that off the dentures. The tissues, everything, the tongue, the teeth, you need to keep that off, because that's the problem that we run into. I'm going to demonstrate some brushing of the denture. So this is just a model. When you go to pop this out, use your fingernails to kind of just pop that denture off, and then you will just use a denture brush. We try and provide these. Let us know. We're going to get in there. We're just going to scrub. Like, no rhyme or reason. Just make sure you're doing this over something that where if you drop it, it's not going to break. This end here, we'll tuft it in. We'll get into the crease of the denture itself where it sits on the tissue. You see that white stuff, just go after it, try to get it off. If it's hardened, it's probably my job to get it off, but just keep it as clean as possible. When you're brushing real teeth, we're just going to use the same model, the regular toothbrush. Just make sure they're getting in there and going at the gum line. That's where the problems are really the most abundant. People, will just and leave it, but they need to be in there a little bit longer. Make sure they're getting the tissue up, and then the tongue. Okay, great. Even edentulous people who do not have dentures, they don't have teeth, they don't have anything in there, I try to give them a toothbrush, get in there, get that tissue, and tongue. Okay, once a day. Also, I am a big fan of getting them some antibacterial mouthwash. I have them use it at night, so we're not eating and drinking it off right away. And this will reduce the number of bacteria in there. It helps your job a little bit easier, mine as well. I've also noticed that the elderly are having a lot of problems with food impaction. So what I encourage you to tell them is to go ahead and rinse after each meal, get that extra out. It's kind of hard to see on this, but right here, back here where the tissue and your cheek kind of meet back here, that's where it packs. Like there and up here in this vestibule, it's called the vestibule, up here and down there. So take a quick peek, make sure that's getting out of there. I've noticed a lot of that going on as well. Let's see, mouth swabbing, you can do that. You can take those little mouth swabs, get back there, especially those that are bed bound, maybe not very coherent. Just get in there and at least swab. I also encourage people to do it during bath time. Take your clean washcloth, just wipe out in there. I mean, anything helps. Anything is better than nothing. So that's great as well. And I'm going to encourage anyone that wants to reach out to me. wcallball@era.care. You're more than welcome to reach out to me. I'll leave that up a little bit longer. I'll try to answer any questions that you may have for me. It's all about our residents and keeping them healthy as we can. So I thank you for your time. I hope this is helpful. Bye-bye.